Experts have been telling us it was inevitable, and yet the news overnight that a Dallas healthcare worker has tested positive for Ebola, the first known case contracted in the U.S., still came as somewhat of a shock, mainly because the news seems to put into question the integrity of all those protective measures and meticulous disease protocols we've been hearing so much about. The Centers for Disease Control report the victim was a member of the medical team that treated Ebola patient Thomas Duncan, who died from the disease last week. As to how it happened, officials will only say there was a breach of protocol, an ambiguous assessment that's raising some very troubling questions tonight. We have full coverage starting off with Mark Potter in Dallas for us. Mark, good evening.
Good evening, Lester. Healthcare officials say they always knew there was a chance that someone else could be infected with Ebola here, but they're very concerned it turned out to be a healthcare worker wearing a protective suit. When authorities learned a Dallas healthcare worker had tested positive for Ebola, they moved quickly to seal her apartment and car. Hazmat cleaning crews arriving late this afternoon. Neighbors were notified.
Hey, guys.
The mayor himself going door to door.
For it to be next door, it's like really close to home.
Doctors say lab tests confirmed a worker at Texas Health Presbyterian Hospital was infected with Ebola. After reporting Friday she had a low-grade fever, she was isolated for testing.
The entire process, from the patient self-monitoring to the admission into isolation, took less than 90 minutes.
Officials have not yet identified the worker publicly, but they say she had extensive contact with the late Dallas Ebola patient, Thomas Eric Duncan, who was put on a ventilator and a dialysis machine as his condition worsened, and he became more infectious. The health worker wore a protective suit, but officials suspect a breakdown in safety measures.
At some point, there was a breach in protocol, and that breach in protocol resulted in this infection.
Experts say problems sometimes occur as workers take off their protective suits.
You might have fluids on your equipment, you might have infectious stuff on your hands. Getting it off effectively without contaminating yourself is hard.
One other person in contact with the healthcare worker after she got sick is now isolated for testing. 18 other hospital workers are also being monitored, along with 48 people who may have had contact before Duncan was diagnosed.
While this is obviously bad news, it is not news that should bring about panic.
Officials still insist that by careful monitoring, they can prevent an Ebola outbreak. And on a day of bad news here in Dallas, at least some good news in Omaha, where doctors say that Ashoka Mukpo, the NBC freelance cameraman, has turned the corner and is showing a marked improvement in his Ebola treatment. Lester?
So, Mark, breach of protocol really doesn't tell us a lot about what happened. What do they plan to do to make sure things go right moving forward?
Well, the first thing they need to do is investigate and find out what happened. And then they say they're going to institute some new safety procedures around the country. Fewer people in the room with the patient, fewer procedures, and someone assigned to the team to only look after safety procedures and make sure that they are followed so this doesn't happen again. Lester?
Mark Potter, thanks very much.